a 32-year-old patient, sickle cell disease, progressive shortness of breath, worsen with exertion, and improves at rest. Lung sounds are clear. Reduced DLCO. Which of the following is the most likely diagnosis? This question is a quick reminder that sickle cell disease can cause all of these. Let's first talk quickly about the pathogenesis. Here we have three pathways. So when cells sickle, this leads to free hemoglobin release into plasma, and that causes nitric oxide depletion. And we all know that nitric oxide is responsible for vasodilation. So when nitric oxide depletes, it causes persistent pulmonary vasoconstriction, and that goes with endothelial injury and vascular inflammation. They both lead to intimal hyperplasia and medial hypertrophy of small pulmonary arteries, and that raises the pulmonary vascular resistance, which causes pulmonary hypertension. Also, nitric oxide depletion causes bronchoconstriction and endothelial dysfunction, and that leads to airway hyperresponsiveness, known as asthma. Also, sickle cell disease causes what's known as acute chest syndrome, and when it becomes recurrent, this leads to repeated lung injury and ongoing inflammation, and that leads to pulmonary fibrosis. So back to our case, which asks about the diagnosis. We first see two clues. First one is lung sound, second one is DLCO. So we can easily now exclude asthma because there should have been wheezes. Also, the DLCO in asthma is high, not low. And knowing that DLCO is low in both pulmonary fibrosis and pulmonary hypertension, we should remember that lung sound is never clear in pulmonary fibrosis because there should have been some crackles, not a clear lung sound. So the correct answer is C. And here are our side notes which I recommend you to read.